Hello, I'm Terrence McNally, and welcome to Freeform, a world that just might work. And I'm going to be speaking today with Wendell Potter. Potter walked away from his job at one of the country's largest health insurers to emerge as a critic of the insurance industry and an advocate of reform. He's a best-selling author, he leads a couple of nonprofits, and he publishes Healthcare Uncovered on Substack. And you can learn more about all of that at wendellpotter.com. WENDELLPOTTER, all one word, wendellpotter.com. On Freeform, we explore the lives, the work, the ideas of individuals that I suspect have pieces of the puzzle of a world that just might work. We look at politics, economics, environment, science, health, culture, all based on the fact that I believe we can do better, and I want to find out how. The show streams weekly on the Progressive Voices Network on TuneIn.com, and podcasts are available anytime, anywhere at Apple Podcasts, Spotify, most major podcast sites, and at my site, terrencemcnally.net, TERRENCEMCNALLY, terrencemcnally.net. Needless to say, we are deep into election season, and I encourage you to get involved, not only with candidate campaigns, but also with efforts to fight voter suppression and assure that all Americans have their right to vote, as if the future depends on it, which it very much does. For those of you in safe states like California, where the presidential race may be a foregone conclusion for one party or the other, you can make a difference in down-ballot races to help win congressional, state, and local seats, and to build a future of progressive office holders. Here's some specific recommendations. First, the Democratic Party and its candidates may be far from perfect, but if we are to ever again have a viable multi-party system, I strongly recommend you repudiate the Republican Party up and down the ballot. Not a single vote for one of them. Make them pay for their anti-government, anti-democracy, voter-suppressing, minority-ruling ways. Second, to get involved in campaigns, I recommend you check out Third Act, an organization founded by Bill McKibben in 2021 to empower elders, those 60 and above, to protect the climate and strengthen democracy. You can find them at Third Act, one word, thirdact.org. Third Act SoCal, the local working group, has launched a project called Adopt a District, so that voters in the safe state of California can work in 4 swing congressional races to flip the House. Go to thirdact.org/SoCal and then scroll down and click on California is the swing state for the House. Another good organization that can plug you into battleground states is OurRevolution.com. OurRevolution, all one word, .com. This is the group founded by Bernie Sanders to promote progressive policies and candidates. To donate money, I highly recommend Movement Voter Project, who help progressive donors support the electoral efforts of the best local, grassroots, community-based organizations in key and battleground states, rather than sending your money to the party or a candidate's campaign where, sadly, too much of it is spent on television advertising and expensive consultants. You can learn more and donate at movement.vote. Movement.vote. Now to today's conversation on the sad state of healthcare in this country. As a former player in the health insurance industry, whistleblower Wendell Potter has experience and perspective that is rare. But let me offer a few bits of data to support my contention that our healthcare system is broken. The U.S. continues to have the highest health spending per capita among comparable countries. In 2021, the U.S. is $12,914 per capita health spending, was more than double the average for other comparably large and wealthy countries, where it was $6,003. What do we get for all that spending? Well, life expectancy in 2021 was 6 years shorter in the U.S. than in peer countries, 76.5 years in the U.S. and 82.3 years in comparable countries on average. Over the past 3 decades, midlife mortality in the U.S. has worsened significantly compared to other high-income countries. And for the younger 20 to 44-year-old age group, in 2019, it surpassed midlife mortality rates for Central and Eastern European countries. While wealth and economic prosperity are highly correlated with lower maternal mortality rates, the U.S. is an outlier with the highest rate of pregnancy-related deaths. when compared to similar countries. Patients in the U.S. are more likely than those in comparable countries to report experiencing a medication or medical error during their care. And how does all this affect individuals and families? According to federal survey data, people in the U.S. owed at least $195 billion in medical debt in 2019, and most people with medical debt owed more than $1,000. Medical debt accounted also for nearly 67% of U.S. bankruptcies, 2 out of 3 in 2023. 1 in 4 adults say that in the past 12 months they have skipped or postponed getting health care they needed because of the cost. Notably, 6 in 10 uninsured adults say they went without needed care because of the cost. And almost half of insured adults worry about affording their monthly health insurance premiums. And finally, how does political spending factor into all this? Well, of the top 10 recipients of campaign cash from 7 insurance industry PACs, all but 2 are Republicans, and all of them are in leadership positions that enable them to keep the tax dollars flowing to private insurers. Wendell Potter walked away from his job at Cigna in 2008, and as I say, emerged a critic and a reform advocate. He leads 2 healthcare reform advocacy nonprofits, the Center for Health and Democracy and Business Leaders for Healthcare Transformation. His books include Deadly Spin, an insurance company insider speaks out on how corporate PR is killing healthcare and deceiving Americans. Obamacare, What's in It for Me, What Everyone Needs to Know About the Affordable Care Act, and Nation on the Take, How Big Money Corrupts Our Democracy and What We Can Do About It. And Potter is the publisher and executive editor of Healthcare Uncovered on Substack. It's all one word. Welcome.
Thanks so much. Good to be with you.
Yeah.
Appreciate the opportunity.
And let me tell listeners, we're recording Tuesday, September 10th. And as I told Wendell before we got on the air, I can remember actually the first time I saw him on Bill Moyers in, I think it was 2009, and you recently put out a post on your Substack that celebrated the 15th anniversary. I like listeners to get a feel for the people behind the work and the ideas we talk about. So normally my question is, can you tell us briefly about, how you see your path to the work you do today, and feel free to go way back. Mentors, turning points, moments of decision. In your case, I feel like that story is a key piece of who you are and why people should pay attention to what you've got to say. So, your story of your path.
Well, I appreciate that. I think you're exactly right. I am kind of a unicorn to a certain extent because I became a whistleblower and testified before Congress against the industry that I had worked for 20 years because I had risen up through the ranks and to the level that I really understood how these companies really operate, how they had gotten to be so big and so powerful and so much in control of our healthcare system and our lives. I had to go back a few years, though, because I was a newspaper reporter in my first career. I was a journalist, and I tried in all my reporting in Tennessee, where I grew up, and also in Washington, where I covered Congress and the White House. I always tried to be very honest and straightforward, never to omit any important information, never to obscure anything that would lead people to believe something that just simply wasn't true. And I came to realize ultimately that what I was being paid well to do in my corporate career at Cigna and Humana was the exact opposite of that. I was being paid a lot of money. I've often said that it would have been more appropriate, more accurate if my title had been head of propaganda or chief propaganda officer, because that's what I did. And I mentioned Tennessee. I think that has a big bearing on my decision ultimately to leave the industry. I grew up in a small farming community in northeast Tennessee, in the mountains of East Tennessee, really a poor Appalachian community. And that's where I came from. And I was someone who was able to, over the years, leave poverty and to get a good education. I had a lot of mentors along the way, a lot of support to help me, including, of course, from my parents, who saved as much as they could so that I could go to college. I was the first person in my family to do that. But had it not been for that upbringing, I probably wouldn't have had the empathy that I ultimately had for people who I ultimately saw trying to get the care that they needed. And this was toward the end of my career in the industry. But I went back home to visit family from Philadelphia, where I worked then and still live, and I was vice president of corporate communications at Cigna at the time. And I went down there just to visit family, but I picked up a newspaper while I was there, and I read about something called a healthcare expedition that was being held just a few miles away. I went there out of curiosity, and it was life-changing. I went to this county fairground across the state line in Southwest Virginia. We're still in southern Appalachian area, coal mining section of Southwest Virginia, and I saw people who were lined up on this in the county fairground, waiting to get care in barns and animal stalls, all kinds of care. It wasn't just blood pressure checks. I mean, these were people who did not have any access to care that they could afford. They, in many cases, worked, but they didn't work for an employer that offered benefits, or work for an employer that offered benefits, but those the health plans had such high deductibles, which has become prevalent, that they couldn't go to the doctor. They couldn't afford their out-of-pocket requirements. So they resorted to going to barns and animal stalls to get care once a year, in Wise, Virginia. And it just shook me to my core. I realized that people who were standing in those lines were people I could have grown up with. And it could have been me, Terrence, because if I hadn't been lucky to have been born to Blaine and Pearl Potter, who wanted me to get ahead and scrimped and saved, I probably would have been someone in those lines. And they were standing on those lines, and it was raining. They were soaking wet, but they were not going to leave their place in line because they didn't have any other alternative. And I made a decision that day. I just had to figure out some other way to earn a living, and I also realized that what I was being paid well to do was the exact opposite of what I tried to do when I was a newspaper reporter. And it was just a devastating realization for me to come to grips with what I was doing, what I had become. And I ultimately, a few months after that, did walk away. There were some other things that happened that were that kind of pushed me ultimately to leave my job. But that was probably
this was the pivotal moment where some shade fell from your eyes.
It did, and I've often used biblical or spiritual terminology because it was like that. It was like having a realization, coming to terms with the harm that I had caused people, and I really felt an absolute obligation not only to leave my job, but to figure out some way to make amends for all that I've done. And that's why I'm still doing this 15 years after leaving my job and testifying before Congress, becoming a whistleblower. I felt that this is a never-ending thing. As long as I'm able to draw breath and be able to do this, I'm going to try to keep doing it because it's so important. Their system is so broken, and while we've had important legislation that has almost miraculously been enacted in recent years, it's still so fundamentally broken, as is our political system, which you referenced my last book, Nation on the Take. A big part of the reason why our system is so broken is because our political system allows big corporations like the ones that I work for to really call the shots, to influence campaigns and public policy in ways that is just criminal. It should be outlawed.
Yeah, I've got more questions about those times around your decision and questions around your decision. But since you just brought it up, I did want to touch on Nation on the Take, because at first you're focused on making amends. You're focused in the lane you were in, even if you've changed sides. But what you learned eventually led you to this book, in which I say you broadened your view that the same factors that saddle us with overly expensive, relatively ineffective health care, and I say relative to other countries, relative to what we should expect, diminishes our chances for success in all sorts of areas.
Yeah. It's very true. One of the things that I did at Cigna, my team managed the political action committee
Wow.
donations to candidates. So I knew how this was done. And it doesn't take a lot of money to influence a congressional candidate or a state legislative candidate. We're talking about contributions as little as $1,000 or $5,000 that has influence, and then it can go up from there. And as you noted at the top of the show, that the contributions go largely to leaders of Congress or a legislative body.
The ones on the right committees, the ones who are
Absolutely.
gatekeepers.
Exactly. They're called the committees of jurisdiction. They are essential. You cannot get important legislation passed without going through one of these committees of jurisdiction, and they're always chaired by members of Congress who have seniority and
Right.
are in leadership. And so that's where you send your money. You send your money to rank and file members as well, too, who you think can be in your back pocket when you need them. And they've got plenty of money to throw around. It's just incredible how much money they
And
do
as
that.
you point out, I was surprised too. In other words, when I went and looked at the 10 biggest, right?
Yeah.
And I saw that someone ranked in the top 10 with all he got was 30,000 that year from the insurance industry.
Right,
It seems like nothing, and there is no greater return on investment for corporate dollars than investing in their local officials.
Absolutely. It is absolutely the best investment they make. It's a little investment when you consider the vast amounts of money that they have, that they take from us in premiums.
I mean, that 30,000 to this guy and 20,000 to that woman ends up being worth billions.
Oh, it absolutely does, because you can protect profit margins, you can protect the status quo with a very little bit of money. Those contributions count. Those members of Congress, those candidates, if they get elected, they remember that. And the lobbyists don't let them forget that
Right.
either.
That's their job.
That's their job. That's their job, to have a presence all the time as a reminder that we gave to your campaign, and we'll keep doing that. Or if you turn on us, we'll see if we can get you defeated.
Yeah, we'll primary you if you
Exactly.
you really change. And I'm reminded of the folks when they're at a doctor's office, they see the pharmaceutical ad people coming in, or if they watch some of the movies and documentaries about OxyContin in with their little sales things, and here's a little, invite a doctor to a weekend at a great resort so he'll prescribe your medication. Pales, a drop in the
yeah.
bucket compared to what those lobbyists are doing in officials' offices.
Exactly, and that what you described is something that's visible and pretty widely known. But what we're talking about is behind the scenes, and even those contributions you mentioned, that $30,000 from a political action committee. There are also others. The executives of these big companies also shell out quite a bit of money. I hadn't looked into that. We're going to be doing that project again later, but to broaden that we'll be doing more to show where campaign contributions are going through this entire election season. But it's an enormous amount of money that we finance. It's our premium dollars. I want people to understand that we're not talking about Cigna's money. We're not talking about United's or Aetna's money. We're talking about money that we send to them to enable us to have access to care and to cover our necessary medical care. And they've come up with all kinds of ways to avoid paying for it, number one, but they skim off a big part of it for the propaganda campaigns, their lobbying campaigns for campaign contributions.
Right. So we're financing their ability to do less and less in return for that finance.
Exactly. They are screwing us in so many different ways.
Oh, God. Okay, so I do want to go back to, during your time in the industry, you created health insurance front groups to mislead the public. I just think this is something that is hidden to people. Tell me about that.
The reason for that is that the industry knows that if they see a commercial on TV and it says paid for by Cigna or United, or even the trade group for these companies, which is AHIP, or America's Health Insurance Plans, people will become suspicious and see that as being self-serving. So we created, and they still do this, they create these front groups that sound like they're consumer organizations. I remember one that we created to try to keep the Affordable Care Act from being passed was called Healthcare America.
Sure.
They have names like that, deceptively crafted to mislead people. Obviously, even the names are misleading. But a lot of money is poured into those so that people don't know. And we see them. If you were in a state where you see a lot of political advertising, I'm in Pennsylvania, and it's just wall to wall.
Oh, wow.
It's ridiculous.
Yeah.
It's just absurd.
Much less here in California, as I said,
yeah.
a safe state.
Yeah, the safe state. You should come here. You wouldn't believe it. You can't turn the TV on without being subjected to some kind of political campaign or a commercial that is paid for by one of these so-called front groups. And you're going to be seeing it across the country too, by these big companies that their current big cash cow is from the public programs,
right.
not necessarily
right.
from commercial payers or from you and me or our employers, but they're sucking so much money out of the Medicare program and the Medicaid program. And the government can take some actions to pay them generously or not so generously, and they get really upset if the government gets a little bit stingy. And the government this year was a little bit stingy, and they're mad about that. And so we're going to see commercials showing up around the country from the industry, scaring people that the Biden administration or a certain member of Congress has voted to cut Medicare. That's how they operate. It's very deceptive. But it's very self-serving.
Right. I hadn't even thought of that. Again, because we're not seeing those commercials so much here. Everybody knows that Biden's going to win California. I mean, Harris. Oh,
you'll see them next door in Arizona, Nevada.
Yeah. And what he's pointing out there is you can literally, that's accurate. The federal government is cutting Medicare, but it's only cutting it for their pocketbooks, not necessarily for you.
Well, even more accurately, it is giving them less of a raise than they demanded. Right. It's not really cutting it. It is, from their perspective, not getting as much as they thought they were going to be getting. And so they interpret that as a cut.
Sure. A decrease in the growth is a cut.
Yes.
And we will. I'm definitely going to make it that we have time to talk about Medicare Advantage, because I feel like that is something which you and your Substack devote a lot of attention to, because I mean, I'm only going to tease it here and then and we'll get back to it. But I think the reason you devote so much attention to it is because there's a tipping point at which their effort to privatize healthcare, and their driving force right now is Medicare Advantage, begins to shift everything in that direction. And to me, it's very close at this point.
It is absolutely. The industry realized that they could manipulate or persuade policymakers, as we were just talking, to make the Medicare Advantage program a real cash cow, and they've done it over many years. About the past 20 years, it actually started in 2003 when George W. Bush was in the White House and Republicans controlled Congress. That was kind of the origin of these massive overpayments to private insurers, and the intent was to turn the entire program over to big insurers. And they've just, they've made a lot of headway. More than half of Medicare enrollees are now in those plans.
That's what I learned recently. It's over 50% of seniors actually choose a Medicare Advantage plan.
Yeah, and it's because these companies are able to get away with, once again, deceptive advertising. They are able to obscure important information about how these plans really work. And most people don't know the difference between traditional Medicare and Medicare Advantage. They think they're lured into these programs because they see ads that say you're going to get free hearing, free dental, or something like that.
Yep.
And that's appealing because traditional Medicare doesn't cover things that it should be covering. But people are lured into these plans. They are not required to tell you that you're going into a private plan, that some bureaucrat somewhere is going to be calling the shots as to whether or not you're going to get the care your doctor says you need. You probably will not even have access. You will not have access to all the doctors that are available in the traditional Medicare program because their networks of providers are always much smaller. So people are getting screwed left and right in these plans.
Yeah.
And that's why I write as much as I do about this, because we need to sound the alarm that do not enroll in these plans. Now, that said, Congress needs and the administration needs to do whatever it can to improve the traditional program. It was created in 1965 when the world was quite different.
And things cost a hell of a lot less.
Oh, it was just a tiny fraction of what they are now.
Let me ask you, because I don't know this figure, but I know that healthcare in America is something like 17% of GDP, which is way more than it is in any other advanced country. Do you have a sense of what it was when Medicare was invented?
Not quite that far back, but I remember when the ACA, the Affordable Care Act, was passed, it was far less than it is now.
Yeah, closer to 12%, I think.
It was, yeah, I think it was, and I think we're probably talking about no more than 5 to 10%. Yeah. Back then, and probably not even that, because what has happened, the way we allow this system to develop, you need to know that private insurance companies do not have an incentive to control cost. They do have an incentive to keep you from getting the care that you need, but they don't have an incentive to reduce the unit cost of goods and services. And
which, by the way, I mean, before people kind of just go on with what you're going to say, think about that. Most companies, you would think, would have an incentive to reduce the cost of what it is they apparently, or in the way the system works, are paying for. And yet, in this whole huge area, which I said was 17% of our GDP, they do not.
No, it operates exactly the opposite of it does in most industries, because you see, as healthcare costs go up, as a stay in the hospital, the price of a stay in the hospital or prescription medication or a doctor visit, as that goes up, these companies, because they've got such a grip on our system, are able to demand higher premiums that our employers pay and that we pay out of our pockets and out of our taxes, that enable them to get more and more revenue. So they want to increase both their top line, which is their revenue, and their bottom line. And so that means they don't have a real incentive to control costs in a meaningful way, because they want those revenues to go up and up and up, and they are able to demand from our employers who have been sold a bill of goods for all these years. They keep the employers in the game, thinking that they've got to be in this game. More of them are beginning to wake up.
Yeah.
But it's taken a damn long time for them to wake up.
And let me just jump in quickly, Wendell, and tell people, this system that you've seen since you first got your Social Security card and got your first job, that healthcare is connected to employment, is not normal. There's nothing that says that's the way it should be. It isn't in other countries. It was a gimmick of sorts during World War II, when there were two things going on. One, workers were scarce because men were in the service, and women were, entering the workforce and so on. So scarcity of workers and price controls meant that if you wanted to get people, you had to have something to offer them. And so employers hit on this idea, in combination with healthcare and insurance companies, that they would offer healthcare. And because of that, we've been stuck with it ever since.
You're exactly right, and we can even go back a decade before that. But you're exactly right. That was the beginning of our path, our journey down this path that has led us to almost, actually ruin for a lot of families.
Oh my God, yes.
Untold numbers. But in 1935, the Social Security Act was passed when Roosevelt was president. It was part of the New Deal. Frances Perkins was the Department of Labor. She was a big, probably the most staunch advocate of the Social Security, but she also tried to push Roosevelt to consider and include universal health care.
Oh my God.
He considered it, but he thought that's just too much of a heavy lift, because it's going to be hard enough to get Social Security. The doctors were not on board with it, and they were inordinately powerful back then. So he passed on that, and that was a big miss, unfortunately.
Yeah.
If we had, because most countries later did that, and some
post
during
World War II, when the social democracies came, when they saw that that things had to change following World War II and following what had happened, most of them went to the social democracy model, which
Yep.
created a safety net, which included universal health care.
Exactly right. And we go back to our political model. The reason why we haven't done what they did is because we allow special interests to really have inordinate power, much more than they do in any other developed country. The American Medical Association was dead set against the creation of Medicare. It took a lot to overcome their opposition to even get that program established, and they continued to fight anything. They called it, when they enlisted Ronald Reagan to call Medicare socialism,
Yep.
and it almost didn't happen because of Ronald Reagan and his advertising of the AMA. The AMA has, I think, awakened to the problem.
Yeah, over the last, I don't know exactly when it began, but they were a bulwark against universal health care, and now they are no longer that. Now I think it is the insurance companies and the big hospital companies that provide the opposition.
That's right, and that's it's important to understand that, because while they were fighting what they referred to as socialism, they were believing that the private sector would deliver them into nirvana. And what they have seen is that the private sector has turned on them, and the private sector now is controlled by these gigantic companies that I used to work for. They're far, far bigger than they were when I left the industry. And healthcare providers, even hospital administrators, are now beginning to realize that, we've got a monster on our hands here. What are we going to do now? So, all that said, that may present an opportunity to get healthcare providers to understand and get engaged in ways they have not before, and change teams, to be honest with you.
Yeah, so we'll jump into that. I just want to go back again, because I think the personal piece of this is fascinating. And that is that I was curious, when you walked away, came out, switched sides, how did your colleagues respond? And also, how did they respond to the sorts of things that made you walk away? There's a thought here that companies are individuals, and individuals are helping these companies make decisions that sacrifice lives for profits. And a lot of people will ask that, how do they look at themselves in the mirror? How do they go to sleep at night? What was that like? And I guess you could throw into this combo question here, why did it take you 20 years?
Well, here's the thing. Unless you have visibility into the C-suite, you don't really know how things are really done and what motivates the executives of the company. I was able to do that. I was a part of leadership.
You were high enough.
I was high enough to see it. But most people, United Health Group is by far the biggest insurer conglomerate. They claim to have over 400,000 employees. Most of those employees are low ranking. They don't make a lot of money. They're in departments that they do what they do, the kind of the equivalent of making widgets, and not realizing why decisions are as they are, and they're isolated from that. The other thing, though, that as you do climb the ladder, you're rewarded to be blind, or to turn a blind eye on things that you see. You're paid well. You feel like you've got some position of power and authority, and you do. And you don't want to give that up. And your personality, your ego is kind of wrapped up into your title
identity,
and the work that you do, your identity. So walking away from that is extraordinarily hard. And it's only a few people who have the kind of visibility that I was able to get, or to be a part of, to understand, oh man, this is how it really works. The real stakeholder that is sacred here is the shareholder. It is not. It's not the healthcare provider. It's not the patient. It's not the consumer. It's not the employer.
It's not the doctor.
It's not the doctor. It is the shareholder, and we're not talking about mom and pop shareholder who might have 10 shares in Cigna. We're talking about gigantic institutional investors that hold the stock in these companies, and all they want is a return on their investment. So that has enabled this not only to continue, but to even get worse, because Wall Street is in control of our healthcare system in ways people just don't understand.
Right, and I'm going to throw in one more thing. That is that the thing that I'm beating on week after week is stock buybacks. And
Yes.
and when you say, the shareholder, in too
Yeah.
many damn moments, that shareholder is the C-suite themselves.
Oh,
Because
absolutely.
if they
Yeah.
do stock buybacks, that will increase the value of the stock, and they get paid based on stock options and performance. That every time they buy back stock, it basically increases their
Yep.
wealth. And you
Yep.
point out that Cigna was attempting a merger with Humana. When that merger didn't happen, they didn't throw that money into reducing premiums or helping care. They bought $11 billion worth of stock buybacks.
Yeah, and even this year, that was what, a couple of years ago. This year, they said they were going to buy back a total of $9 billion of their own shares. All of these major companies are doing this,
And they're buying
and
that with the money we spent on premiums.
exactly, and your point is exactly right. One of the responsibilities I had was to answer questions from reporters who called when we announced, if you're a publicly traded company, you have to disclose the compensation of the 5 or 6 or however many top executives in your company. And I would always, as a talking point, tell reporters, and they bought this without question and without understanding the significance of it, that 90% of our CEO's salary was at risk, which meant that it was at risk of how Wall Street viewed the company and how the share price was going. Because most of his, as you noted, most of his compensation, 90% of it was paid in one form or another in stock. Whether it's a stock grant, a stock option, you name it. And that's why we call it at risk, because the stock price fluctuates. And when a company has a bad day on Wall Street, the net worth of the CEO goes down.
Yep, every day.
And
Yeah.
every day. So your net worth depends on that.
But the other thing that I hear when you say that, Wendell, is that 90% of their motivation.
Yes. See, exactly. That's a very good point, because if it's 90%, how much that doesn't leave you much to think about your customers, the providers who actually deliver care. They're kind of an afterthought.
Yeah. I mean, every other concern, it counts for 10% of your compensation. Stock price counts for 90. And so all your motivation is to raise the stock price.
Exactly, and to make rich people even richer.
I didn't know that. Okay, let me tell people. This is Free Forum, a world that just might work. I'm Terrence McNally. I'm speaking with Wendell Potter. And as you've heard, he walked away from his job at Cigna, one of the country's largest health insurers, in 2008 to emerge as a critic of the insurance industry, an advocate of reform, as he said, making amends for the privilege that he'd enjoyed and the way that working within a system, he'd in some sense abused that privilege. He's a best-selling author, leads a couple of nonprofits in this advocacy realm, publishes Healthcare Uncovered, all one word, Healthcare Uncovered on Substack. And so anything that you're learning here, I learned it, a lot of it in that Substack. And you can learn more about all of this at WendellPotter.com. WENDELLPOTTER. If you had a few minutes in a room with those guys who are thinking about their 90% of their wealth that depends on the stock price, and you wanted to convince them not to look just at profits, is there anything you think you could do to change their minds, and where would you direct them?
No, you can't. You can't, because well, maybe that's too much of a blanket statement.
But your reflex was so quick; it shows what your gut tells you.
Yeah, what I came to realize is you cannot change these companies from the inside, because the need to meet Wall Street's profit expectations is too paramount. It's pervasive. It's all that you care about, and your career depends on it. What I thought, one way to answer this, I wish that I could get the CEOs of these big companies to go with me to one of these clinics. And to see when you are at that level, you're so far removed from how most people in this country, not just the poorest, but middle class folks, you're removed from the struggles that they have day in and day out to make ends meet, to get the care that they need. You are unaware. I was shocked. I had no idea that there was a need in this country for these clinics put on by this organization called Remote Area Medical, which started out to fly doctors to truly remote places on the planet.
Of course.
And then they started getting calls from communities in the U.S., and now most of their clinics are here.
Sure.
Not in Haiti, not in some of the poorest countries in Africa and South America and wherever it might be. But I would like to take those guys and say, look, this is what our system is. This is what people have to resort to. You know, we still have 30 million people in this country who don't have insurance, but you have 3 times that many, if not more, who have insurance, but they can't use it because of the barriers that these companies have erected so that they can preserve their profit margins. And those barriers take the form of excessively high out-of-pocket cost, prior authorization requirements. In other words, they have the ability to say, no, we're not going to cover that, even if your doctor says you need it, and to restrict your access to doctors and hospitals. They cut deals with the doctors and hospitals they want to have in network, so you may not be able to see the best doctors in your community.
Let me just share a quick experience so that people know this. This goes across the board. I'm on Medicare. When I went on Medicare, I meet with a insurance broker, and his job supposedly is to serve me by pointing out what options I have, and most of these options, and I'll throw out my individual case, and then if you want to comment on it, go right ahead. Would you like to just live with your Medicare, or do you want a Medicare supplemental or a Medicare Advantage plan? And my first year, I looked and I went, well, the Advantage plan is free, and the supplemental plan was like, at that point, $400 a month or something. And I went, well, I'm not that sick. I'll take the managed care plan. What it meant was my premiums were free, but I had to get everything pre-authorized, everything. Yep. And what I then moved from Los Angeles to Long Beach. And when I went to, I had asked, by the way, this broker, I gave him all the doctors that I considered seeing and said, are they in network? And at that point, I think I even knew that I was moving to Long Beach, and so I gave him some Long Beach names, and he said yes. Well, he was misinformed. They were in the larger network, but they weren't in the right doctor group. And so when I, at a certain point, halfway through the year, wanted to see someone closer to home, they were in the network, but they were not in that physician's group, and it was limited to that. And and I'm someone, I'm going to say I'm someone who knows. You can tell I pay attention to this stuff, and I got bit.
Oh, so many people get bit. People who well, the reason is because we're misinformed, and anyone should ask of a broker, how are you paid? Who pays? Where do you get your money?
Right.
And if they're honest, they will probably say from Humana or Cigna or Aetna, whatever it might be. But even if they don't, if they say it's an independent company, you need to ask, well, where do they get their money?
Yeah.
How does this work? Because at the end of the day, regardless, they're not working for you.
Nope.
They're working for themselves to get as much money as they can, and ultimately for the big insurance companies, because you are a dollar sign to those guys.
That's right.
They want as many as they can get. That said, Humana and Aetna in particular realized that some of the acquisitions they made in the last year or so brought them people that are using too much health care. So this fall, they're going to be cutting those folks loose. They're going to be running them away, and people are going to find out that their Medicare Advantage plan that they've been in is not going to be available to them, and they're going to be scrambling to try to figure out what to do next.
And let me ask you, because I know that insurance companies, and you specifically cite Cigna at one point, would look at the small, they wouldn't want to cut their ties with a big corporation, but if they start looking at small businesses and they notice that certain small businesses have a on a set of employees that are using too much health care, they will just individually hike the premiums for that small business to kick them out of the
Yep.
plan. How do they
Yep.
do it to individuals?
Well, they hike the premiums. Like if you get your coverage on the individual market, most likely you get it from the marketplaces that were established by the Affordable Care Act, Obamacare.
Right.
You can enroll in a plan today, but next year you may get an excessive premium increase or have greater cost sharing obligations. So there are various ways that they can get you. But in a Medicare Advantage plan in particular, you are an individual signing up for the most part, but they can decide they're not going to sell any coverage in your county, and that's what we're going to be seeing.
Oh.
So a lot of people who are enrolled, probably not in Los Angeles or Long Beach, but in some parts of the country, smaller markets in particular, they will say, well, that county is not as profitable, and so we're going to leave that market. And that's how they do it. Or they increase your premiums, make you pay more out of pocket, do other things that is referred to as benefit buy down. You're paying, you have to pay more, but the value of what you're paying for has diminished. So that's another way. They want you to, if they can't get rid of you, they're going to make you pay more in one way or another.
Yeah. You read something recently which said that there are three things that kind of account for the enormous growth in the biggest companies and the enormous growth in their profits. And one is vertical integration. And this, my guess, is news to a lot of people and scary as hell. Changing sources of revenue, and that's the shift to Medicare Advantage as a big driver, although that's going through flux right now because the government finally noticed and had enough people not on the take to actually make a change, and then barriers to care. So if you could just quickly tell people, this is why things are going out of control: vertical integration, changing sources of revenue, barriers to care.
Yeah, we've touched on those changing revenues.
Right.
It's worth noting that over a recent 10-year period, like from 2013 to 2023, United Health, Aetna, and Humana all saw actual decreases over those 10 years of people who are enrolled in commercial plans. All of their growth, every single person who is an additional enrollee in the aggregate came from a public program, either Medicare Advantage or Medicaid. So that's where they gravitated because they saw that, again, as the government, Uncle Sam being so generous because of their political clout. Back to vertical integration, that started not long after, it started actually before the Affordable Care Act, but it just has been on steroids since then. These big companies have decided they can get into healthcare delivery and make a lot of money that way and avoid paying rebates if they miss a metric called the medical loss ratio. We won't get into that because it's complicated.
Right.
But by getting into healthcare delivery, they've made an enormous amount of money, and I will mention one in particular. The big companies, CVS, which owns Aetna, also has a big pharmacy benefit management entity. It's called Caremark. Cigna has Express Scripts. United has Optum Rx. Those three companies control 80% of the pharmacy supply chain. They suck enormous amounts of money out of the pharmacy supply chain.
And let me just ask for you to expand just a little bit on this. This is a piece of the sausage that most people don't know about, which is the middlemen between the pharmaceutical companies who are crazy for profits, the insurance companies that are crazy for profits, and the middleman that helps them both is now usually owned by the insurance company. Explain that middleman situation.
Yeah, and it really is a middleman. When you go to the pharmacy and pick up your prescription, the price that you pay, and it can vary depending on whether it's you or your sister or your brother, whatever, you will pay a different price. And it's because of the deals that these pharmacy benefit managers cut with manufacturers and the relationships they have with pharmacists, they're able to get more money than the pharmacists are paid or that the manufacturers make. It's insane.
Now, did you guys, I just want to remind people that the person in the middle, the
Pharmacy Benefit Manager, or PBM. The acronym is PBM.
Right, the PBM is getting more out of the money than the pharmaceutical company, which we know the prices are outrageous, or the pharmacist who's delivering, the person who has a brick and mortar store there for you.
Yeah, it's one of the biggest scams in history.
And right now, the fastest growing, most profitable division in United Health is Optum, which operates their PBM, but it also operates outpatient facilities, kidney dialysis giant DaVita, which you see all around, and the physician practices. And that is kind of outrageous that the insurance companies now own the doctors.
Exactly. I appreciate your plug for Healthcare Uncovered. By the way, it's free. You don't have to pay for it. You can if you want to, but I want all the content to be available.
Oh, great. Thank you.
We're going to be showing people, explaining how these companies are structured these days, what their components are. It'll blow your mind.
Yeah.
How many hundreds of companies, how many physician practices and clinics.
Well, you said United Health is now the country's biggest employer of doctors. They have 50,000 doctors. And when they had a breach recently and a software issue, doctors around the country were scrambling because their payments were held up by United.
Exactly, and I can almost guarantee you that nobody knows who employs their doctor. People don't know that their doctor, in many cases, gets their paycheck from United Healthcare. That's just kind of bad, don't you think?
Well, also, it is something you alluded to before when you were talking about how they might cut off a rural county from their Medicare Advantage plan because it wasn't. This is one reason that doctors' practices are dying in rural America.
Yes, exactly. They're able to steer people who are enrolled in their health plans, whether it's a commercial plan, whether you buy it individually or through an employer or through Medicare Advantage. They're able to steer you in one way or another to the physician practices and clinics that they own. So they're capturing even more of your money, and that is starving a lot of the independent practices that are still trying to make it. There are a lot of doctors who don't want to sell out, but the majority of them have already sold out to either insurance companies or big hospital systems. So we need to do what we can to reverse that trend, to make it possible for independent practices to stay independent, to survive.
Now, isn't one of the things that drove that, because I was thinking about the sometimes the unintended consequences. We all, I think, agreed that it would be great to get off of all those paper files in doctors' offices and move things to online.
Yeah, the electronic health records, yes.
But one of the things that I've heard that did was the investment in the computer capacity to actually do that made it harder for small independent physician practices to do it. And so they allowed themselves to be bought. They became part of UCLA Healthcare or Providence Healthcare. This is what's happened to just my own doctors, so that they could afford the investment in computer. But now it ends up that they're part of this monster.
It's true. Practices need a lot of capital to be able to have the technology they need. We're talking about not only the electronic systems that enable them, or they have to do electronic health records, but also to keep up to speed on technology and healthcare delivery.
For what they're serving.
Exactly. That's expensive stuff. So they've got to have enough money coming in the door to compete with other practices to keep the doors open. And increasingly, it's difficult for them to get that kind of capital. So they, in many cases, seem as if they have no alternative.
Right. To compete in today's market, they've got to be bought by a big company.
Yeah, that's the way the world has gone.
Yeah. Okay.
The way this country has gone.
I'll give you one closing statement, but you got about 4 minutes to talk about Medicare Advantage, just because I think this is where a lot of your attention has been, and it's a critical piece in this whole mess.
Yes, in October we'll start once again seeing all these ads for Medicare Advantage, and they'll lead with the so-called freebies, the extra benefits that they offer. Do not fall for that. Now, as you were saying earlier, if you're healthy and you think that you can get by without much trouble, you're taking a gamble here. By the way, they're forcing us to gamble on whether we're going to be healthy the next year. But also, if your income is not all that great, and a lot of people when they retire don't have a ton of a disposable income, so when you're faced with the option of a Medicare Advantage plan, which
let me jump in for 1 second, Wendell.
yeah.
As someone who hasn't reached Medicare age would say, why are we talking about options here like Advantage and supplemental? It's because Medicare, as wonderful as it is, usually covers 80%.
That's right. Yeah.
What we're talking about is the extra 20% of your healthcare costs.
That's right. And keep in mind, it was created in the 1960s, mid-60s, when the prevailing model for health insurance for everybody, because healthcare was relatively inexpensive, you paid 20%. That was what commercial folks paid, so that's how the Medicare program was. It was modeled on that. It's become so expensive now that 20% of a medical bill can be pretty damn big.
Oh my God! Yes.
So that's where we are. So Congress really needs to address structural changes to the Medicare program to cover more.
And wouldn't you say? And I'll say this very quickly because I don't want to stop your flow, but that the simplest adjustment almost would be to add those freebies, that is the dental and the vision and maybe the exercise classes, to standard Medicare, because people don't use them anyway, but it does get them suckered into Medicare Advantage plans.
Exactly. People don't realize that it's not all that valuable, but they think it is. And you're right. It wouldn't be an enormous expense to be able to offer those, but you also need to have an out-of-pocket cap so that people are not having to pay just an outrageous amount of money once they get sick.
Right. In other words, when I went on Medicare, the notion of paying 20%, even though I've taken care of myself when I was relatively healthy, still was like, wait a minute. I know how an unexpected expense of 20% of any sort of big medical cost is going to be something I don't have room for.
That's right. And as you said earlier, buying a Medicare supplement policy, I'm in one. I'm thankful that I can afford it.
Yep.
It can be expensive. It's a monthly expense. But the upside is that I never pay anything out of pocket. Ever since, and I've been on Medicare for some time, everything is covered. And I go to any doctor, any hospital I want to go to. There's never any insurance company bureaucrats saying, no, we're not going to cover that because we don't want to cover that. That does not happen in traditional Medicare. So it's a trade-off. But if you can possibly swing buying a Medicare supplement policy, I strongly encourage you to do that, because people die early every single year in this country from having enrolled in a Medicare Advantage plan, and they just don't realize what they're getting into.
Yeah, I mean, just some notes I got from your work here. 99% of Medicare Advantage plans require prior authorization for prescribed treatments.
Yes.
Prescribed means the doctor said you need it. Now, they get to say, we'll decide that.
That's exactly right. And every one of these is a subjective decision, either made by a person whose salary is paid by the insurance company or by an algorithm. They increasingly are using AI to deny care and claims.
And then the other thing I was saying was that the inducement is you won't have a monthly premium. That's the first big one. But the other are these little freebies. It turns out that Cunningham Cook in your Substack pointed out that only 11% of Advantage policyholders use the dental care benefit.
Yeah. But when the way it's advertised, you think, oh, well, I'm going to have a big dental expense. Most people do not.
Right.
But it's perceived to be something of greater value than it really is.
Yeah, and that's why I said if they changed, and of course this is where the lobbyists come in, if Medicare offered the dental benefit, it might very well be that only 11% would use it. So it's not like it would be a big expense to the government to actually include it and take that inducement out of the hands of the insurance companies.
Exactly, and there are some progressive lawmakers in both the House and the Senate who really are going to be strongly advocate. They have in the past. They just haven't been able to get it done yet. But hopefully we'll see another push next year with the next Congress and the next administration. Let's keep our fingers crossed
Yeah.
that there
So,
might
Wendell
be an
Potter,
opportunity.
this is your closing statement, and let me make it two kinds of closing statements. One is, what do you want people to think about? The other is, where should they go to learn more?
I want you to think and understand that the way our health system is controlled by these big, gigantic, massive companies like United and Cigna and CVS Aetna. And they, in turn, are controlled by Wall Street. And they are the only incentive they have is to make more and more and more profit. And the ways they do that is to make your health care less accessible to you. You pay more every year in premiums and more out of the pocket, and the value of your coverage is less. That's one thing I want you to always know. See these big insurance companies not as good guys. You'll see a lot of their image advertising.
Sure.
They are not good guys. That's one thing. To stay informed and get involved in some kind of an advocacy organization, there are plenty of them. Look at my advocacy organizations, but please subscribe to Healthcare Uncovered, because we cover that industry aggressively and in ways that people can understand. It's not wonky stuff.
Right.
Sometimes it's you can't not get a little wonky, but you need to know this stuff.
Yeah, I mean, once you, healthcare, if it's 70% of the GDP, it's likely a big part of your spending. And as you get older, a bigger and bigger part. As your income taps out, your healthcare expenses go up.
Exactly.
It is not something you should leave to other people to figure out. This is something you should get involved in.
Exactly. And when you're young and healthy, you just don't think about it. You need to think about it.
That's right. Okay, let's bring it to a close. This has been great, Wendell, and let's do it again in the future, because
sure,
there's pieces of this we didn't even get to, such as the movement of private equity into health insurance. Don't get me started. Okay, so again, the websites are wendellpotter.com, WENDELLPOTTER, wendellpotter.com. Healthcare Uncovered is the Substack, and that's all one word, Healthcare Uncovered. And Center for Health and Democracy.org is the nonprofit. As he said, look for an advocacy organization, get involved. It's us against them and their billions. His latest book is Nation on the Take, How Big Money Corrupts Our Democracy and What We Can Do About It. For this conversation and many other interviews and articles to join me in pursuit of a world that just might work, go to TerrenceMcNally.net, TerrenceMcNally, all one word, .net, or aworldthatjustmightwork.com. They're the same website. If you want to get my weekly email announcement telling you who's going to be on, what we're going to talk about, and usually links to 8 to 15 articles to flesh out the conversation, email me at temcnally, TEMCNALLY, TEMcNally at mac.com. You can also subscribe and listen to the Freeform podcast on Apple Podcast and Spotify and most of those podcast sites. You'll find years in the archives. I've been doing this for over 20 years. Michael Lewis, Jeremy Scahill, Naomi Klein, Robert Reich, Van Jones, on and on. You can follow me on Twitter at McNally Terrence. I guess that's X now. Thanks to Kiana Williams in production, George Vasilopoulos at Progressive Voices, and most of all, you, my listeners, please share this podcast widely. And finally, thank you, Wendell Potter. Keep up your good work.
Thank you very much. Thanks for having me on.
Okay, great.
Thank you.